Let's do this. Getting my morning Starbucks. Here's my order.
Good morning. Welcome to Starbucks.
Hi, good morning.
How are you today?
I'm good. How are you?
Doing pretty well. What can I get for you?
May I have a grande soy mocha?
Grande soy mocha, sure.
And may I also have a...
We do have a new breakfast wrap, a bacon sausage and egg wrap. If you'd like to try that one.
Ooh, that does sound exciting. I'll give that a shot.
Awesome.
Yeah,
All right.
thanks.
I've got you at $12.66.
All right. And may I also have a cup of water, and that'll call it for me?
Yeah. Do you want 16 ounces, or do you want to do a little bigger water?
I think 24, right?
Oh, yeah.
Yeah, thank you. All right.
With ice?
Sure.
Awesome. I'll
Thank
see
you.
you at the window for $12.66.
Awesome, thank you. He was so nice. All right, I'm gonna pause it since he probably doesn't want to be on camera. Ooh, this lighting. Oh, guys. All right. Okay, so I'm here. I am at what I like to call at this point ground zero. I'm currently sitting in the parking lot. Yeah, I'm in the parking lot. I didn't really see too much activity going on. It is, mind you, 5:46 in the morning. I don't know what's going on. So as I said, I'm going to, those doors look, okay, so those doors look wide open, y'all. Hang on. Do you see them? Yeah, right there. They were just open a second ago, but there was nobody sitting there. So I guess we don't do any quarantine or anything like that, or any assessments prior to entering the building yet. I guess that happens after 6 when we have employees. So we'll find out. I drove past the front of our entrance. I didn't see anybody there aside from people who are getting ready for surgery. So we'll see. I'm gonna go in. I'm gonna do my thing, and then I gotta go check people in. So I'm gonna be that first front girl for y'all. Woo! So I will check in. I will probably do this when I have breaks. I'll check in and tell you what's going on, okay? So apologize for the lighting again. We're working on it. I mean, I'm still learning how to use this GoPro I got, so we'll chat, okay? All right, so that's update 5:47 a.m. I am in the parking lot, and I'm about to walk in. Let's see what it looks like in there. All right, so as of this moment, guys, hey, this is like my first 15-minute break. It's about 8:43 in the morning. Still here. This is Evergreen Hospital. I'm in the parking garage since I, just due to the nature of what's going on, it's really questionable. I have not seen a CDC employee yet. I have not seen any screening happening. So I'm a bit, this is not my favorite hat for this type of thing, for pre-opping people, but maybe it'll look better now. Sorry, I've got some bridge going on there. Woo! So I don't see anybody screening. I'm not in the same building, you guys, as where we had the cases. That's the ICU and the ER, which are on the opposite side of the building I'm at. But I am not really seeing a big presence. I can see that people are a bit concerned, but they're really looking to healthcare providers for information. So I've been doing a lot of instructing and teaching today, talking about hand washing, talking about how to properly use an N95 mask, and probably why it's not a good idea to use at home since you don't have where to dispose of it. You haven't been fitted for it. So the best thing to do is to wear a mask. If you, just a regular plain yellow or pink mask, some of them are blue, whatever. And what that is for sick people. And the reason why I say that is it keeps your cough and your talking, like people, believe it or not, you spit a little bit when you talk because your tongue moves in your mouth and you can send off particles and what we call droplets into the air that way. So droplet and airborne precautions are kind of how I'm seeing this situation right now, since we don't really know exactly how it's transmitted. because of that lack of information, I'm suspecting it's airborne. So it's hanging in the air. And so for people who are in a closed area like this, like a hospital, who are probably most at risk for exposure, having the N95 mask for us is probably essential. I got 2 reports now that one of the universities in the area had their N95 masks stolen. And I received a report from one of my old ERs in South Florida that they also had the same thing happen. People are putting them probably on the black market because they think they're valuable. Guys, it's ridiculous. But hey, you know, people want to make money on the scare. So as for me, as for my recommendation currently, I'm not really seeing a ton of people freaking out yet. I have heard that there have been some quarantines that are being done in the area, of course. One being the facility where the 2 patients that came to this hospital. That place is completely quarantined. Nobody's coming in and out, and I think there's a CDC presence there. I'm not sure what the plan is. I think what's going to end up happening is when the CDC starts doing its rounds, it's going to end up coming and kind of giving more information. So we're following, I guess, the guidelines of the hospital as of this time until further notice. So that's what I got as of this morning. I don't know much more. I'm still seeing patients coming in and out of the hospital like business as usual. So as of this moment, that's kind of what's happening. I haven't seen anybody sick yet. We hopefully will get more info about that, but I have seen a lot of people wearing masks, especially the Asian community. We have a lot of Asians in this area, and they are proactively putting masks on, which I think in the American population can kind of cause some concern as well. It's very commonly practiced in Asia, and most of the time, and for example in Japan, people wear them when they're sick so that they don't get other people sick. It's more of a conscientious thing, but I'm seeing today that people who are healthy are wearing them, so that doesn't really make sense to me, but that's why we're here to instruct and to teach, because that's what nurses are really, really good at. So if you're concerned, I need you guys to know that I'm currently here. I don't have a fever. I'm healthy as of this moment. I will report in if I do start getting some symptoms, okay? So I hope you guys have a fantastic day. I'm going to keep you posted on what's going on. Like I said, I'm coming into the car because it's such a weird kind of situation, and a lot of people can have and sense some mass panic. So I don't want to do that. So a lot of people, when they see a camera pop up, they freak out. So I'm just here on my phone in the car. All right. So I'm going to go find my sandwich. I will talk to you guys later. All right. Take care. Hey, good afternoon, you guys. It is the afternoon. I tried to do a check-in with you guys a little earlier, but it got to be a little crazy. So I will fill you in. Pretty much, I haven't seen any patients come in symptomatic. Patients had started to get screened at the door, and we were only essentially sending people away who showed any signs or symptoms. Will I say that I was impressed with the screening process? No, I'm not impressed. We were definitely more hands-on when the Ebola crisis that had happened. And so either it's the hospital system, or I don't know, it could be how the CDC is disseminating information, since I'm seeing that there's just such a there isn't a really great system of communication. That's my biggest concern right now. Otherwise, I have been noticing that really not too many patients have been coming in sick. A lot of patients have been coming in kind of concerned, kind of scared. So I've talked and educated quite a few people. I've read the current CDC guidelines that were issued out, I believe February 21st. Information, and the guidelines really haven't changed. What I do know is that they're treating it like a droplet virus. So your N95s are going to work if you're in a healthcare facility and you have access to more than one N95, of course. Patients who are showing symptoms should be wearing masks to cover their coughing and sneezing. And the other reason why we're asking people to wear non-N95 masks, so let me just differentiate non-N95 masks versus N95 masks, is the N95s they have to be disposed. They're we dispose of them in the hospitals when we've been in an isolation room. So I see a lot of confusion going on. The regular masks are meant to remind you and to kind of contain, like if you sneeze or if you, I don't know, cough, that contains it inside of this little guy here. But it doesn't stop you from, I guess, saying things like, okay, well, don't touch your face. Those are all kind of things that people are being instructed on. The droplet means it can sit on a surface. I don't know how long, since that's not information that I have, but surfaces, contact surfaces, I would assume that the survival rate is probably similar to some of these other viruses that have been around. So that means, they can sit on a surface for a couple days. So please wipe down your surfaces. Think about cars, think about your cell phones, think about doorknobs, think about places where you put your hands, which is everywhere. So try to wipe down everything, I guess, as best as you can. As for what I saw at the hospital, I really kind of wasn't impressed, in the sense of we're putting out information, printouts, recommendations from the CDC. I didn't see one CDC person, that or they didn't announce themselves, which is also possible. They kind of just want to go look around and see what's going on. So yeah, there's that. But guys, really, I didn't see anything. It was really, really uneventful. I had patients come in. We had a couple cancellations. But as for where I'm at here at the hospital at ground zero, nothing really is going on. The main, though, I would suspect is where they're doing more focused, concentrated screenings. So I don't really have to deal with the main, and nor do I want to go that way, because I could be at risk to be quarantined, as in a forced quarantine, which means I don't have a choice. Yeah, that's so, like, the cruise, the Princess Cruise that's, sitting off the coast of Japan or whatever, that's in a mass quarantine, or, some of these other situations where we're seeing quarantines popping up. This is a prime location for something like that. So I wouldn't want to be putting myself at risk for that, because that would stop my job. That would stop a lot of stuff. So yeah. But otherwise, no, nothing is really happening. I haven't really seen anybody mass panicking. As I mentioned this morning, I got reports that people are going and stealing N95 masks from facilities, which I think is really wrong. Really takes a really horrible person to do that, but okay. It's not going to do you much. All we know is that you're tricking people into buying them, and that's another mean thing to do. So overall, I think that this is just a really big, I don't know, it's not like the other ones that I've experienced. Like, it's not like Ebola. Ebola was handled very, very aggressively, very differently, and it was a very scary virus. So this one, it's new, it's different. What they like to call it, your most vulnerable population as of this time is still in the 50s, 60s, 70s, 80s, etc. Children are being spared, so it's already kind of unusual, since in a lot of coronaviruses, usually kids get them. So I'm shocked that I'm not seeing that many kids catching it. So I'm interested. I guess they're going to be little vectors, who knows, for this, all those little hands. So please make sure that you're protecting your families. Make sure that you're wiping stuff down. If you have a cold or sneeze, we're doing this. Washing your hands. Anytime you come in contact with something that could possibly come in contact with other things or your face, make sure you're washing. I've seen that sanitizers have become a hot commodity. I looked on, somebody had posted something on Amazon that some of them are selling for $20, $30, $40, $50. That's insane. Hand sanitizers, guys, is alcohol. Just get some, like real alcohol, like rubbing alcohol, for goodness sake. And there are some homemade versions of hand sanitizers, some using Tito's handmade vodka. So in case you would like to have a drink while you're making yourself some homemade sanitizer, have at it. So as of this moment, I'm not impressed. I will report back in pretty soon. We are seeing, though, that the influx of patients is definitely decreasing due to how much publicity this particular hospital has received. And I will continue to report back, unless, I guess, they fire me. Who knows? I'm a per diem gal, so, who knows? So please understand that this is still something that's running through the population right now, and it's just really easy to get scared. And so just take care of yourself, keep your immune system up, and I don't know, maybe just turn off the news, because it's just getting weird. It's just, ugh. Guys, yeah, if you have a family member who is immunocompromised, or you have a family member who could possibly catch something or isn't vaccinated, please be careful. Please understand that this is new. We don't have a vaccine for it. But you know, you do not want to fall sick with something else and be susceptible to catching this as well, because that's how we get those issues. Your immune system gets completely worn down, and then something else hits you, and that's where we see 25-year-olds die from the flu. Okay, and I've seen that. So guys, this is my report for my day, and I hope you guys enjoyed. Yeah, I'm being very cautious because a lot of people are very paranoid. So, you know, here we are. Okay, so Millennial MP, I'm out. Have a fantastic day, you guys. I'll keep reporting as best as I can. So take care and be healthy. Eat well or something.